Good morning to you. Good morning to Abdiel, and thanks for recalling that today's my birthday. And I really appreciate your words and good morning to all the staff with us here, and above all to all the people who tuned in from different parts of Cuba and abroad. And today, as a birthday gift, this is the fifth consecutive day we are not reporting fatalities in our country. You might think it's a lie, but this is the best gift I could have. There are 527 patients admitted in our hospitals, 325 suspects, 195 confirmed. These are the active cases we have, and 7 people are under surveillance. In observation by our primary healthcare system, by our specialists, doctors, nurses, there are 1,955 people. They are people observed due to some epidemiological risks or because they are quarantined after being discharged. Yesterday in Cuba, 2,100 samples were studied. This is another gift. The Pedro Curie Institute of Tropical Medicine Laboratory, 1,244. At the Laboratory of Havana, 278. In Santiago de Cuba, 196. In Villa Claras, 145. In the Amejidas Brothers Hospital, 143. And in the Biotechnology and Genetic Engineering Center, 94. As a result of the analysis of these 2,100 samples, 12 tested positive for COVID-19 or SARS-CoV-2 for a 0.57% of the processed samples. In this way, since the beginning of the pandemic in Cuba, and we always remember the first 3 cases that were diagnosed in Trinidad on March 11, 112,449 samples have already been analyzed, and of them, 2,119 people, 1.9%, have tested positive for COVID-19. The 12 cases confirmed yesterday, as had been happening in the last few days, they are all Cuban. 100% of them are confirmed case contacts. And that is the importance that every time a person is diagnosed with a disease, that the person can identify all those who have been in contact with him in the last 14 or 15 days so that these people can be isolated and studied. And in this way, in the behavior of the pandemic in Cuba, of the 2,119 confirmed cases, 1,861, or 89.5%, are contacts of confirmed cases. Yesterday, none of them was left without specifying the source of infection. And in any case, we are still working on finding the source of infection for 84 people in our country. With a source of infection abroad, there are still 133 people referred in previous briefings. Of the 12 new cases, 6 are female, and 6 are male. In the cumulative total of people diagnosed in Cuba, the female sex went ahead with 50.3%. 1,066 people are female. Of the male sex, their cumulative total is of 1,053 cases, representing 49.7%. 7 out of the 12 cases, 58.3%, were asymptomatic at the time of the test, and there are already 1,111 people, that is 52.4% of those confirmed to this day. This shows one of the gravest threats of the disease, and it is the high number of cases of people that show no symptoms at the time of their diagnosis. And after having studied the behavior of these cases for several months, These people spread the disease before showing symptoms, and this is why this is a very important risk. The age group with the most cases were the group of 40 to 60 years with 5 cases, and under 40 with 4 cases. No children were diagnosed yesterday. And by provinces, 7 of the 12 cases are from Havana. That's 58.3%. They are distributed in 6 municipalities of Havana. And as we have been stating recently, 5 of the 7 cases confirmed in Havana are epidemiologically related with the ICA Pharmaceutical Laboratory. Although they are scattered in various municipalities, they share a common source of infection. In the case of Matanzas, 5 cases were confirmed yesterday, all from the municipality of Matanzas. And over the last 15 days, the positive rate per 100,000 inhabitants, Havana stands in the first place with 8.57% per 100,000 inhabitants. Matanzas in second place with 3.61. Artemisa in third place with 0.97. And from there down, we are speaking of 11 provinces and the special municipality of Isle of Youth that for more than 15 days, or at least the last 15 days, they have not diagnosed any confirmed case of COVID-19. I'm referring to Villa Clara, Las Tunas, Pinar del Río, Granma, Vallaveca, Cienfuegos, Sánchez Espíritus, Camagüey, Holguín, Santiago de Cuba, Guantánamo, and the special municipality of the Isle of Youth that in the last 15 days have not diagnosed any case of COVID-19. And this shows that we can and that we will achieve this control all over the country. Of the 2,119 patients diagnosed with the disease, as I said at the beginning, 195 are still admitted as active cases, and of them, which is very important, 191, 97.9% have a stable clinical course. We always regret the death of 83 people throughout the whole behavior of the pandemic in Cuba. That gives us a lethality of 3.9%. Cuba, with this lethality, remains in the 17th place, and the lethality of the region of the Americas currently stands at 5.57%. There is a group of countries with high mortality rates in our region, and we must always also mention the 2 evacuees. There were 9 discharges on the day. We did not manage to have more cases discharges than confirmed cases. That also goes along with the number of cases diagnosed of the last 15 days. And thus, 1,839 people out of the 2,119 who have been diagnosed with the disease are now recovered, clinically discharged, or epidemiologically discharged. We mentioned today 4 patients in serious condition today, the same ones we had said yesterday. 3 in the Salvador Allende Hospital and 1 in the Pedro Curie Institute of Tropical Medicine Hospital. The world is no less convulsed than in previous days until June 3rd, yesterday at 12 o'clock in the evening. 185 countries were reporting cases of COVID-19. 6,384,900 confirmed cases. Only in one day, 103,548 confirmed cases. 380,810 deaths. In one single day, 4,383 for a lethality of 6%. As you can see, the number of confirmed cases and what is worse, the number of deaths from this disease does not decrease. The region of the Americas yesterday the region of the Americas confirmed 62,572 cases. And now, for a total of 3,019,104 confirmed cases in our region, and that represents 47.55% of the total cases that have been reported in the world. Yesterday, 3,002 people died in our region for a total of 168,264 deaths, and that gives a lethality of 5.57%. With this, we finished today's information. I know that you had agreed that another gift for me today would be not to ask me questions. They are going to be saved for tomorrow, but I did not want to finish without thanking all the gratitude and that I have received since yesterday. The acknowledgement by our president in his remarks yesterday, that today, he said that today was my birthday, and I think that is something that when I started in this activity, I never imagined that something like that would happen. I would also like to appreciate the affection and recognition of many people. Senior leaders, even the president tweeted something about it on his Twitter account, and several people spoke about me. And I'd like to reiterate that this appreciation is not for me, but it belongs to all the health workers who ultimately do what I present to you in this briefing. Finally, in addition to this gratitude, I wanted to show, because I was asked also to do it, something that when I saw it, I said today, I was really surprised. And it is this puppet, who one day appeared on television. It even sports the blue jeans that I usually wear, and I was really surprised by the way they depicted my hair, and it was done with a lot of love. It was made by a group of children troupe called the Teatro El Ánimo from Villa Clara. And the children sent a note with the puppet saying, "Thanks so much, Dr. Francisco Duran. Only a special person can inspire the creation of a puppet for children." So with this very touching gift, I would like to thank, and I reiterate, all the shows of appreciation that I have received since yesterday from many people, and especially, of course, from our president. Thank you very much.